Dear colleagues, welcome to the OncoAlert Roundup for March 27th to April 3rd, 2025. These are just some of our picks, and for a deeper look, we invite you to register for our newsletter at www.oncoalert360.com or through the links in this post. That's www.oncoalert360.com. Starting out with news from the FDA. On March 28th, the FDA expanded the indication for lutetium or Pluvicto for PSMA-positive metastatic castration-resistant prostate cancer patients, demonstrating significant improvement in radiographic progression-free survival, but no significant difference in overall survival compared to androgen receptor pathway inhibitors. And on to lung cancer, low-dose CT for lung cancer screening in high-risk populations. The SUMMIT study demonstrates that large-scale low-dose CT lung cancer screening is effective, highly sensitive, and feasible for diverse high-risk populations, supporting its integration into national screening programs. Real-world outcomes of Tarlatamab in small cell lung cancer, including patients with untreated brain metastases. This real-world study of Tarlatamab in heavily pretreated small cell lung cancer patients showed a 42.9% response rate, but higher than expected rates of cytokine release syndrome and neurotoxicity, highlighting potential safety concerns outside clinical trial populations. On to GU Oncology. A comprehensive systematic review and meta-analysis of PSMA PET for prostate cancer diagnosis and primary staging before definitive treatment. This systematic review and meta-analysis confirmed the diagnostic value of PSMA PET for detecting clinically significant prostate cancer and staging, especially when combined with MRI, but emphasizes the need for further research to incorporate it into predictive models for biopsy and lymph node dissection decisions. Results of stereotactic body radiation therapy for primary renal cell carcinoma in a large multi-center series. This study demonstrates that stereotactic body radiation therapy, or SBRT, offers high local control, preserved renal function, and an acceptable toxicity profile, making it a viable treatment option for inoperable primary renal cell carcinoma. In GI oncology, neoantigen-specific tumor-infiltrating lymphocytes in gastrointestinal cancers. This phase 2 trial showed that neoantigen-selected TIL therapy combined with pembrolizumab improved response rates in treatment-refractory metastatic gastrointestinal cancers, suggesting a potential immunotherapy approach for a traditionally non-responsive population. And we end up with breast cancer. Selective elimination of breast surgery for invasive breast cancer. This phase 2 trial suggests that for select breast cancer patients with residual lesions after neoadjuvant systemic therapy, omitting surgery and using radiotherapy alone may be feasible, as no recurrences were observed after 5 years. And the last breast cancer trial is clinical characteristic and prognostic factors in patients with breast cancer and leptomeningeal metastases from a large registry of BMBC. Patients with breast cancer and leptomeningeal metastases have a poor prognosis, but survival is influenced by clinical pathological factors, with better outcomes seen in those receiving radiotherapy, endocrine therapy, or HER2-targeted treatments. And there you have it, folks, this week's roundup. Look forward to seeing you next week.